Welcome to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. February is American Heart Health Month, and while we don't need a dedicated month to talk about our heart health, it is a good way to raise awareness to our heartbeats. In this episode, we're going to talk with a physician who is dedicated to keeping our hearts beating through prevention and some balance. But first, Millennium Physician Group is a leading comprehensive independent physician group in Florida with more than 600 healthcare providers at 150 locations in 19 Florida counties. We serve nearly 500,000 patients. Millennium Physician Group, your connection to a healthier life. Learn more at millenniumphysician.com. Connection, innovation, inspiration, health. Every week, we talk about the healthcare issues that are important to you. We invite providers and experts to inspire you to take control of your healthcare decisions. Join us right now. Stick around for a healthcare journey as we work together to achieve the best health outcome for you. Well, according to the American Heart Association, every 40 seconds, a loved one has a heart attack or stroke. What are the warning signs? As our most vital organ, the heart should be top of mind when it comes to our health. And we're going to talk a lot about that today with our guest, Dr. Ashu Donjol. She's a cardiovascular physician from First Coast Cardiovascular Institute in Jacksonville, Florida. So right now, joining me by Zoom, I'd like to welcome Dr. Donjol. And welcome to the show. Give us a little bit of background about yourself and how you journeyed to FCCI.
Thanks, Michelle. I'm happy to be here today. So I moved to Jacksonville about 6 months back from Arkansas, and FCCI is the reason which brought me here. It's a unique group and a combination of cardiovascular interventionalists and, cardiovascular physicians like me who believe more in preventive cardiology. We have pulmonologists, sleep medicine physicians, and if you ask me what brings me to FCCI, it's probably their great position in Jacksonville, which, kind of prompted me to come here and join them.
That's awesome. Yeah, we have a wonderful relationship with FCCI. How did you end up, deciding when you were in med school that you wanted to go the cardiovascular route?
So, I have a couple of uncles who are actually cardiovascular physicians. That was the beginning. They were my mentor. And while I was in my residency, my dad had a massive heart attack and passed away. And, that kind of made me go towards more of preventive cardiology and felt like he could have been here if a little bit more attention was paid. He had all the risk factors. And that's why I geared myself towards this.
Yeah, we'll talk a lot about the risk factors and signs and things that we just might not pay attention to in just a little bit. But let's first of all talk about this very vital organ, the most important vital organ as far as I'm concerned, the heart. Tell us, just give our audience like a brief description about how the heart functions.
So heart, as you said, is the most vital organ in the body. The way I explain my patient is that everything from head to toe affects your heart. Every medication that you take affects your heart. Every other organ has any issue, it will indirectly affect your heart. So, and it's the same way around. If your heart is not working fine, it's going to affect every single organ of your body. Mm-hmm. So it's not really the only vital organ. I think it's also the soul of the body too.
Yeah, I have to agree with you. The heartbeat is very important to the brain and very important to the extremities. So I know there's, veins and arteries and blood flow and blood flowing out. Just a little bit of the anatomy of a heart, just so we can start, when we start to talk about the risk factors, we know what we're working on here.
Okay. So imagine heart is a pump, like a water pump. It's a blood pump. And your veins are the one which are the blue colored vessels in your body that you see that bring, in a way, dirty blood or deoxygenated blood back to your heart. And then it goes to the lungs, get it filtered, which brings it back to the heart. And the filtered blood, which is oxygenated or clean blood, goes through the arteries to supply the whole body. So it's like a closed circuit.
Yeah, and that makes sense. So at what point does, the heart begin to fail? We all are, hopefully we have this heart, it's beating daily. What are some of the signs that it's not working the way it's supposed to be?
The science could be very specific and could be very non-specific. So very, very typical or specific science could be chest pain, especially when you walk around, you try to do some activity, shortness of breath, your legs get swollen. Some people just have, palpitations or irregular heartbeat, but they could be non-specific signs. Like sometimes people say, I could walk 2 miles without any issues. And then now I can barely walk half a mile, get tired. So just fatigue, extreme tiredness, just inability to get up, and just feel draggy.
Mm-hmm. How do you determine whether you have heartburn? Sometimes you get like that. Oh, every now and then I'll maybe eat. I don't even know. Not even something spicy. And I'll all of a sudden feel that like sharp pain. And I'm like, I can't breathe. It's just something really bad.
Yeah. The way I tell everybody is that try to see when the heartburn comes. Is it related to food or is it related to when you do something? Every time you climb stairs, you can't have heartburn. But at the end of the day, just go to your physician. Mm-hmm. Don't delay it.
Yeah, that was my next question is like, okay, at what point do I need to get this checked out?
Yeah, as early as possible. There's really, for the heart issues, for cardiac problems, it's better to rule out than wait till you actually have a heart attack.
Yeah. So you mentioned your father. What were some of the pre-existing conditions, or was it hereditary? What were some of the things that were overlooked?
So he had diabetes, which is a major, we consider almost as a cardiovascular disease equivalent. Then hypertension, smoker. And just because he was not following a regular, preventive regime, that it was missed until, he ended up with a massive heart attack.
So, as far as hereditary, how much of of that is something that needs to be considered?
So hereditary is familial history is a big issue, or is a big risk factor, which, when you talk about risk factors, they're controllable or uncontrollable. So your family history is uncontrollable. You could have a family history, but you could delay the progression, or you can't run from your genes, but you can definitely alter your lifestyle so that you can manage, or you can have less damage from the same genes.
We are talking with Dr. Ashu Donjol, a cardiovascular physician from First Coast Cardiovascular Institute in Jacksonville, and just basically how vital the heart is and how to recognize signs of distress. When we come back from our quick break, we're going to really get into why, historically heart disease is considered a man's disease, but it's also very much a female disease, and the symptoms. We're going to talk so much more about that. So you're definitely going to want to stick around. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Every week, we are talking about healthcare issues and what's important to you, inviting providers and experts to inspire you to take control of your healthcare decisions. February is American Heart Health Month, and we don't really need just a month to talk about heart health. It's something we probably should be talking about all the time because, as we were discussing, our heart is our most vital organ. In this episode, we are talking with a physician who is dedicated to keeping our hearts beating through prevention and a little bit of balance. We'll get there. Our guest today is Dr. Ashu Donjol, a cardiovascular physician from First Coast Cardiovascular Institute in Jacksonville, Florida. And Dr. Donjol, in the first segment, we did talk a little bit about risks and prevention and family backgrounds, family histories. But, what about the number one killer, right? Is heart disease still right at the top?
Yes, definitely.
Yeah. And why is that something that's still very much front and center?
We've come a far way in treatment, multiple new technologies, but I think preventive cardiology is where we need to work more, because after all these years, after all this technological advance, we still have number one killer as heart disease. So there's something we're still missing.
Mm-hmm. Is cardiovascular disease specifically targeted at men over women or women over men, or is it 50-50?
So, there's a lot of talk about inequality between men and women, but cardiovascular disease is fair. It comes in women as much as men. Actually, still number one killer in women is cardiovascular disease. 1 in 5 women die from cardiovascular diseases and cardiovascular death.
Why do you think that is?
There are a lot of issues because number one, as you just asked me, everybody still thinks that it's a disease of men. And if a woman is having chest pain, it's probably heartburn. So it is ignored, is not taken care of. And just like any other disease, women tend to ignore everything and take care of the family, put the family first instead of them.
Mm-hmm.
So I know that I've worked very closely with American Heart Association, and there has been a big drive, big movement towards awareness and prevention of cardiovascular disease in women, about education and trying to teach them how to take care of themselves.
Right. And with that, hereditary, that family history, even so as a female, my dad thankfully didn't have any heart issues, but if my dad did, but usually it's almost like the son seems to be the one that needs to be a little more aware of it. But women can't be ignoring those familial backgrounds either.
Definitely not. Because as I mentioned, you got the same genes from your dad as your brother. So our hormones do have a preventive effect on, on preventing us from cardiovascular disease than men. But at the end of the day, you still have the risk of getting the disease, and you need to be vigilant and do the same workup as him.
And how does the disease start to progress? Is it from lack of nutrition, movement? How does that disease, if we're born with it, how does it come to surface?
So, I'll start by talking about the risk factors. So like we talked before, we have some controllable risk factor, we have uncontrollable risk factors, genes, your family history, your age, your sex. These are all uncontrollable. You can have no control over them. But there are a lot of controllable risk factors like your diet. If you eat diet more in fruits and vegetables, less in red meat, or heart healthy diet more accurately, then you can control your blood pressure. You can control your high cholesterol. Smoking, quit smoking if you do. Then managing a healthy weight. Be active. Be active, we mean like about 30 minutes of exercise almost every day, but at least 5 days a week. Mm-hmm. All these factors help.
Yeah, and that's the tough one, I think, when it comes to, like you were saying earlier, taking care of families, especially for women, and just really being able to get to that balance. And we'll talk a little bit about that later. But as far as more about the prevention, how do you take a patient who's kind of stuck in their ways and like, what, I don't feel like changing my diet. I can't move more. How do you work with that patient?
So, ignorance is a bliss. So the first thing I tell them, know your numbers. First of all, you got to know how bad you are to even make a change. Okay. So when we talk about know your numbers is know your blood pressure number. You just go to your doctor and they say everything is good. No, you have to actually know what your blood pressure numbers look like. You get your blood work, you actually need to know what was your total cholesterol, what was your bad cholesterol, what was your good cholesterol. Just like that, how much did you weigh? So what's the difference in the numbers. Now, you can compare those with the normals. And when you give somebody something objective that, hey, you're 10 points off normal, you have a goal to look forward to. And when you tell these people that this is what I'm looking at, it's not like something abstract. You need to just lose weight. How much? You need to bring your blood pressure down. How much? So then if you walk every day, you can bring it down by 10 points itself. That's it. You give up your soda, I'm sure you'll lose 10 pounds, or you just take maybe 2 grams of salt and there you'll go. You'll get 5 to 10 points lower blood pressure. You start with small stuff and then slowly all this positive impact is better. It's reinforcing, Once you see 2 pounds loss of weight, you're like, oh, I want to do more. So if you try bombard somebody with 10 things, they're not going to do even one. So you tell them one thing to start with, and then, something positive happens and say, hey, look, now let's do one more.
Yeah, I think that is an excellent way to look at it. Dr. Donjol is a cardiovascular physician from First Coast Cardiovascular Institute. And you mentioned blood pressure and the numbers. Can you do just a little explanation of the top number and the bottom number? Because I remember it was like, oh, you always wanted to be like 120 over 80. You know, that was your normal. But I'm really low. I historically have low blood pressure. When I went to have my children, I needed fluids to even like get an epidural or anything because my blood pressure was historically low. Can you do a little bit of explanation about is there a new normal? What's normal for me isn't normal for you.
So, I know a lot of people say, that's normal for me. This blood pressure is normal for me. Honestly, normal is normal, abnormal is abnormal, So for everybody, men, women, any race, any sex, normal blood pressure is anything below 130 over 80. And again, I always, like being cardiologists, we always have guidelines. We go by guidelines, we go by a certain, reference values. So AHA, a couple of years, or maybe 3 years back, came up with this new normal range, which is anything less than 130 over 80 will be normal. Anybody above 130 over 80 is abnormal. So the reason behind that was important because when we did these studies, we saw that we were missing a lot of people with high blood pressure who were coming later with heart attacks and strokes. And we had caught them earlier, then we would just have started them on blood pressure medications and would have prevented these complications. So that's why from 140 over 90, they went down to 130 over 80.
Well, that is significant. So is there something you can do that that doesn't require medicine? Is there, reduce stress? I'm sure, some of those typical kind of, just reduce stress, meditate, you like to hear a lot about that. But is there something else a patient can do if the medication isn't quite right for them?
Yeah, or initially, if they're borderline, or along with medications too, if you want to keep the medication doses at the lower value, you don't want multiple medications, you can always do a low salt diet, which is less than 2 grams a day. You can always, walk. Walking is a simple exercise. I don't want you to walk on treadmill or anything. If you just have any issues, just go for walks. And you will be surprised at how simple stuff like walking can reduce your blood pressure.
Mm-hmm. Yeah, just a little bit of movement, a little bit of walking, a little bit of stairs. It was always like, go park at the back of the lot, when you go to the grocery store, and a little extra steps, All right. Well, our guest today is Dr. Ashu Donjol from cardiovascular. She's from First Coast Cardiovascular Institute. And when we come back, we're going to continue our conversation. We're going to talk a little bit about the balance, how to balance that family and keep your health up. So stick around. The conversation will continue. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Every week, we're talking about the healthcare issues that are important to you, inviting providers and experts to inspire you to take control of your healthcare decisions. And this month is very important. It's American Heart Health Month. And I don't know why there's not just a whole year, a whole lifetime dedicated to our heart health. But this month specifically, February, we're going to talk a little bit more about it. And we want to listen to our heartbeats and hear if there are any issues. We are having a great discussion today with Dr. Ashu Donjol, a cardiovascular physician from First Coast Cardiovascular Institute in Jacksonville. And Doctor, we've talked a lot about prevention, a lot about risks, and knowing your risks, with the uncontrollable risks and the controllable risks. But you touched on something in the last segment that I'd like to dig a little deeper into, and that's the balance. The balance of family in a pandemic. A lot of people were working from home with their kids, trying to homeschool during the pandemic a couple years ago, and still ongoing in some cases, but taking a toll on our health too. And the heart, being our most vital organ, probably takes the biggest hit of all. How are you educating your patients a little bit about that?
As we talked in the last segment, just a little bit of, small details can make big changes. First of all, a lot of us who are working from home, they were very active at their jobs, and all of a sudden you sit down. And I know a few patients of mine, they've just got like stationary bikes or, a treadmill, which sometimes they're doing meetings and they can, just do on it. I mean, I know it's a simple thing. It's not very expensive, but who knows how long or, how frequently, intermittently we'll be working from home. And that's a simple thing you can do while at work. Or every day, 30 minutes, you have to keep it separate, dedicated for exercise. And another thing I feel is like, speak up to your family, educate them about heart healthy decisions, about the need to exercise, and just do it together. I mean, I'll give you my example. I never stopped working, but last year, my husband was working from home and kids were doing virtual. So we made it a kind of routine, a family thing. Every evening for an hour, we just had to be out in our backyard playing, tennis or just going on the bikes. But we cannot, it was by alarm. You cannot be inside for that 1 hour. So anything which your family can do will be great. And I've always seen that if you get their family involved, teach your kids right from when they are, young, because we've seen if we introduce heart healthy behavior right in elementary school regarding exercise and diet, it goes, long ways.
I could not agree with you more. I think it's very important. Recess should be for adults too, as far as I'm concerned. It's like, give me my 30 minutes outside. I'm good to go. We're a primary care physician group, so, we're constantly seeing patients, and at some point, there's a time that they need to be referred to a specialist such as yourself. When do we seek out a cardiovascular physician?
So I feel that it's never too early, it's never too late. So as we've talked about before, sometimes it's really hard to distinguish a cardiac chest pain or angina from a simple heartburn. So I feel that there is no harm if in referring a patient who has risk factors, especially like diabetes, high blood pressure, high cholesterol, or anybody above 40 who has, any alarming signs like chest pain, shortness of breath, just even generalized fatigue, and you checked all the basic blood work and it was fine, doesn't give you an explanation why. It's better to send them early on to specialists so that you're not looking at the complications. You send them at the earliest possible suspicion and get it checked out.
Yeah, my husband is convinced that he has something wrong, the widowmaker pain, or can you explain that? I mean, is that just my husband overstressed and feeling like he's going to, have a heart attack at some point? Or is the widowmaker, I know it's a real thing, but if you could talk a little bit about that, that'd be helpful.
So angina, we use angina as like very, let's say, very non-specific way, but angina has a very specific definition. Angina refers to pain in your chest, which is lack of blood supply from one of the heart arteries, okay? Now, typically, if you walk or you do any kind of activity, it restricts, angina, restricts your activity because you have chest pain. You got to sit and rest. And every time you try and move and do something, it comes back, and is relieved by rest sometimes. Now, when you talk about widowmaker, that's basically talking about one of the heart arteries. Essentially, we have one main heart artery, which most of the time divides into three main arteries, okay? The one which goes on front of the heart and is the main or major artery, supplies a big bulk of heart, is the widowmaker artery. So olden days, that's what everybody was like, oh, it's a widowmaker artery heart attack, because if not prevented or if not taken care of in time, it will damage or make a lot of heart dead if you don't take care of that widowmaker artery.
And then what are some of the tests that you do to determine there are issues there?
So the preliminary, and again, I try to explain patients, there's no set test. That's why it's really important to talk to the specialist, because just talking to the patient may change totally which way we're going to go. But the basic test we do is a stress test, which could be, again, two kinds: a treadmill kind of stress test when we want them to walk if able to, Or we can always do a pharmacological or a medicine stress test. And the other important test is an echocardiogram, which is just like an ultrasound of the heart, just like we do ultrasound for pregnant women, simple plain old ultrasound of the heart, which tells us how the heart is beating, which tells us more about the valves of the heart. And then depending on if the people who have rhythm problems or palpitations, we can do a heart monitor of different kinds.
Mm-hmm. And is that what I think I had a friend who had to walk around with a heart monitor on for a while just to track her movements and if her heart was doing the right beating and stuff too. Yeah.
So yeah, we have heart monitors of various duration. We could have a week, 2 weeks, or 4 weeks, which we can put on depending on the symptoms. And basically it tells us what the heart rhythm is doing or if they're going out of rhythm at any time. And we can relate it to patient symptoms based on.
Yeah, that's interesting. Another conversation I had recently was about a pacemaker in the heart that would fire little electrodes, almost like a little mini defibrillator is that a thing?
Really, pacemaker does not shock.
So, okay. Nobody knew. Yeah, we didn't know what we were talking about.
But what happens at times is that pacemaker is a foreign body, okay? And then some people are very sensitive, and when it paces your heart, it depends, again, where the pacemaker leads are. And at times we have to make some adjustments because it can make that person feel it. And you're not supposed to feel it. So it's not a very pleasant sensation.
Yeah, that totally makes sense, actually. So are there still a large number of people that a pacemaker is the best remedy for them?
Well, it depends. But again, older population, if their heart is not beating enough, it's just like giving heart help, like crutches or, glasses or hearing aid. So it's more in older population, or sometimes if their heart is not beating on its own, even in younger population, yes. The pacemaker is irreplaceable. I'm sorry.
Yeah.
So there's nothing else there's no medication we can use for that.
That's interesting. It's a technology that's been around for a really long time too. Yeah.
It is, but then pacemakers, the way they were huge, big old things, which now are much smaller, and they're much more specialized. We get so much more information from them.
That is interesting. You got to love the technology that we can do for our bodies. Well, Dr. Ashu Donjol, cardiovascular physician from First Coast Cardiovascular Institute, anything you would like to leave our listeners with during Heart Health Month?
As you've said multiple times during our talk today, that I wish we could have every day as Heart Health Day, because we can't give enough emphasis on how important taking care of your heart is. But I guess I just want to say, take care of your heart and ask for help as early as possible, because time is essence here.
I think that is actually the best advice you could give, because we don't want to ignore those pains anymore. Well, thank you so much. If you would like to reach Dr. Donjol or any of the First Coast Cardiovascular Institute doctors, they can be reached at 904-493-3333 or firstcoastcardio.com. Several locations in the area. Dr. Donjol, which location are you mostly based out of?
So I do go to multiple locations. I'm at Skinner, Fleming, Dunn Avenue, and Mandarin.
All right. Yeah. All over town.
All over town, wherever you want.
Well, thank you very much. And I really do appreciate your time today and helping us know our most vital organ a little bit better.
Thanks, Michelle. It was a pleasure.
Coming up next, we're going to talk with Amber Wilson. She's the Executive Director of First Coast Market of the American Heart Association. We're going to talk about how they're helping to educate and provide funds for heart health research. The conversation will continue. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you. We invite the providers and experts to inspire you to take control of your healthcare decisions. February is American Heart Health Month, and we've been talking about it throughout the entire show. But joining us now is Amber Wilson. She's the Executive Director of the First Coast Market of the American Heart Association. And we're going to talk about how they're bringing education and helping to provide funds for heart health research. So, Amber, welcome to the show. Give us a little bit of background about you and your role.
Thank you so much, Michelle. Yeah, I've actually been with the Heart Association 11 years this month. So
Congrats.
Thank you. I started during Heart Month 11 years ago, and I've been serving as the executive director around 4.5 to 5 of those years. And so I've been able to work with our community in this capacity for a really long time, and it's something I've really enjoyed, and I'm really thankful for the opportunity to do so.
Yeah, we're thankful to have you guys be such a great partner to Millennium and in the entire First Coast region.
Well, thank you. We're thankful for all of your support as well.
So as part of the American Heart Association, we know national brand, you guys are all over providing walks and all sorts of education and funds. But what is the mission of the American Heart Association?
Sure. So the mission of the Heart Association is really to reduce cardiovascular diseases and stroke, and really to just encourage and inspire community members to know their symptoms, know what to be aware of. But we want to reduce the amount of our community members that are dying from heart disease and stroke. And so at the end of the day, that's what we're working all year to do, and really focus those efforts and try to share those messages even stronger and louder in the month of February.
Yeah. And we were talking earlier about how every 40 seconds a loved one has a heart attack or stroke. It's so frightening that this is still top of reasons people are dying in our nation.
Absolutely. And to think that about 80% of that is preventable is the most astounding number. I think that's what I hold near and dear, because that is why we have to just share our message so broadly, and which is why I'm thankful to have opportunities like this to know that heart disease is your number one killer for both men and women. And we have to just know those signs and symptoms to protect those around us. And also a little plug to also know hands-only CPR in case you're ever around anybody that goes into cardiac arrest. Is so important as well.
Yeah, let's talk about that for 1 second. I remember when I was growing up and I learned CPR for a role that I had in my 20s. And, it was quite involved. It was, you had to do the breathing and the three pumps and back and forth, and you counted. What is the latest and greatest in CPR training?
Sure. And so I love that you bring that up, because what the American Heart Association was finding when that was our guidance in previous years and years ago is that the lay person on the street or a common bystander was way less likely to actually perform CPR, knowing that it involved mouth to mouth and knowing the fear of the unknown. And it was a 4 to 6 hour course. Now the American Heart Association, through research, understands and knows that if we can just get bystanders to know hands-only CPR, which takes about 20 minutes to learn, you can even learn it in 5 minutes on a YouTube video. That more people are being saved, because that's the more people that know it and their comfort level, because it's easy. They can just get down, call 911, and they have a very strong opportunity to save a life until EMS can get there. And so we no longer encourage that for the lay person. We really just encourage to know the hands-only CPR, because we find it to be just as effective while we wait for EMS to arrive.
Yeah, and more people, of course, willing to do that without having to get kind of, into the nitty-gritty of it. I think that's fantastic, and I need to sign up and do that, and maybe watch the YouTube video as well, because I think there are a lot of people, like you said, just reluctant to offer help, especially if they're not certain of the best way to do that. So I love that you brought that up too. So with the American Heart Association, I know you guys are very community focused. There's the Heart Ball coming up. You do the Heart Walk in the fall. Even now with, kind of putting the pandemic a little bit behind us, we always look forward to participating in the Heart Walk. It's a huge event. What is going on right now in the community that has American Heart Association's name on it?
Sure. So as I mentioned, February is Heart Month, and as you're well aware, and really for the American Heart Association during Heart Month, we are encouraging our community members to reclaim their rhythm. So we have a kind of a music focus on it. We don't want anyone else to lose a mom, a brother, a friend, a neighbor to cardiovascular disease. And so for this month in particular, we are really rallying our communities with an urgent message to support each other in taking control of their health. So creating healthy habits, committing to your resolutions, and we're here to guide you through that. And so we are going to be in numerous communities and different organizations this month, working with some of our healthcare partners to really make sure we are educating and inspiring and encouraging as many community members as possible. And then, as you mentioned, on the horizon is some of our more key initiatives, which will start kicking off in April with our Heart Ball.
Yeah, I love the rhythm. Anybody who can keep a beat, it makes sense to me. I love that. You guys also do a lot about blood pressure education. Let's talk a little bit about that initiative.
Sure. So we have established local priorities, which are food security, hypertension, and mental and physical health. And so as an organization, we know that social determinants are what are leading to poor health and lifestyles. And if we don't help to remove those barriers, we're not going to make an impact in our communities. And so just in Jacksonville in the First Coast area, depending on your zip code, you can have around a 13-year life expectancy difference, which is shocking, and it's something that we want to help eliminate. And so ways we're doing that are, again, food security. So focusing in our most vulnerable populations to not only provide food and mobile food distributions, but to provide health education and resources to those community members as well. And then through hypertension, we know that a significant amount of our residents have hypertension. And so we work in communities and in healthcare settings to provide our resources, work with senior citizens in regards to blood pressure management initiatives that they can do right in their home by providing blood pressure cuffs and more. And so really just focusing on that really at a ground level within the community and community partners, but also within healthcare settings as well.
Yeah, I think it's important that sometimes people don't associate the American Heart Association with food insecurity, but the two really do go hand in hand. So I find that you guys, picking up that piece of the puzzle, honestly, for health and wellness is extremely valuable.
Thank you. I think so too. And it's something that we have really been prioritizing over the last few years. And we know we're never going to, there's always going to be a line where we're always going to have people in our community that need resources. But if we can help reduce that, and if we can help reduce some of the other health related concerns that they may have by creating and providing this education and resource, then we're really honored and happy to be able to do that.
Yeah, it's great news. So Amber Wilson is the executive director of the First Coast Market of the American Heart Association. Give us some of your digits, your website. How can we get involved, volunteer with the American Heart Association, just really reach out to you guys if we need help, funding? How do we reach you?
So we can find us on Instagram at AHA Florida. Also, you can email us at ahafirstcoast@heart.org. So reach out there, either one of those places, to share if you're interested in volunteering. You can fill out a volunteer form online. We're always looking for volunteers as we do our work in our community and for our big events that we have coming up. And also, if you need more information and education and resources, our website, heart.org, is the best place to go. But we are more than happy to be a local resource for you as well by reaching out on one of those social or email channels.
Well, Amber, thank you so much. Really appreciate your time today. I appreciate everything that the American Heart Association is doing. I'm going to go check out the hands-free CPR as soon as we get off this call, because you never know when that will come in handy too. So thank you, Amber Wilson, the executive director of the First Coast Market of the American Heart Association.
Thank you so much.
You're welcome. The conversation will continue next time on Inspiration Health Radio. Your healthcare journey is important to us, and our goal at Millennium Physician Group is to work together to achieve the best health outcome for you. Always starts with seeing your primary care provider. See our website for a full list of offices and providers at millenniumphysician.com. In good health, I'm Michelle McCormick. Have a great day.